practical test. And what we marked during the practical test. Here we have the artery, you see? So this artery is a common carotid artery. Where I mark like this, which artery now, you see? The internal carotid artery, yes? And here you have the external carotid artery. So where I pierce here, in external carotid artery. And this artery, the external carotid artery, gives off here the branches. The first one here is the superior thyroid artery. This same what we have here, yes? And the next one is which artery here? The lingual artery, yes? So the superior thyroid, lingual artery. And here, the facial artery, yes. So the facial artery, this one is the facial artery, goes through the, maybe here, yes, this is the same artery, you see? This one is the facial artery, pierced in the submandibular gland. So here, facial. And this artery originates from the anterior aspect. And I add you from your list 2 extra structures of the artery. The one artery originates from the posterior aspect, so the from the posterior region of the external carotid artery is called occipital artery. This one you have, yes. And from the lateral aspect originate the ascending, which artery? Pharyngeal, yes. Ascending pharyngeal artery. So these 5 arteries, the branches of the external carotid artery, is possible marked here. Where I have this specimen, I show you once again the constrictors, because it's possible to mark here. So this one is which constrictor? Superior constrictor pharyngeal muscle. This is the place, look here, where we have the gap. Yes, this one is the gap 1, this one is the gap 2. Here, this space, you see? So if you put here your finger, you feel this space, the topographic space. Which nerve passed through the gap 2? You remember? The glossopharyngeal. So this is the place where I marked this nerve, glossopharyngeal nerves, here, yes? And it's possible to mark. This is the branch of the pharyngeal branch, but still glossopharyngeal. And here's the place where you have the part of the superior laryngeal, so the gap 3, but here is not visible this nerve. Glossopharyngeal and the arteries is possible to mark. From this specimen, maybe I marked you this nerve. Which nerve is here? Is visible now. You know, which vagus. Yes, perfect. The vagus. And this nerve must be the branch of the vagus, the recurrent laryngeal nerve. So this 2 is possible to mark. And the vagus you have, but the laryngeal recurrent nerve you have, this nerve, probably from your list, I do not remember, no. But this is like the branch. It's possible to mark. And the next one?
Basilar artery.
Basilar artery from this cadavers is visible, yes. And this one here, basilar artery, yes. And
Middle meningeal artery.
middle meningeal, here, no, here's this one, maybe here from the dura mater, yes. Middle meningeal artery is a branch of the which artery? Remember? Maxillary artery. Yes. From which part? First, second, or third? First one. Perfect. Yes.
Internal jugular vein.
Internal jugular vein. Yes. Here from this specimen, you see. This one is the internal jugular vein. The next is external jugular vein. Here. External jugular vein. So you must remember, between these two veins, jugular, yes, you have the muscle, the sternocleidomastoid muscle. So here, cross frontally is an external, deeply you have the internal jugular vein, yes.
And brachiocephalic right and left.
Yes, right and left. Left brachiocephalic vein, and here the short one that is visible now. Brachiocephalic right, this one.
Can you
vein.
show the left one?
Left one is here, yes, all of this one.
Okay.
Left, right, and here is the superior vena cava.
Retromandibular vein.
Retromandibular vein. From this specimens here. Here's no, this one is but it's not proper. This retromandibular. Here is the this one. It's a retromandibular, but from this projection I do not mark. Maybe where we change the dissection room, okay? I show you the retromandibular vein. Here it's not visible.
Facial vein.
Facial, yes. So this one, facial vein, angular vein is here. So the tributaries of the facial vein, you must know where pass or where the change name. So this is where cross the inferior border of the orbicularis oculi. Here is a facial. Now is angular vein. Facial, yes. And
Submandibular vein.
submandibular vein. Here's this one, submandibular. This is the submandibular artery and submandibular vein. So the vessels, because where we mark this, submandibular artery. And
The nerve, so the phrenic.
Phrenic nerve. Here's the position. So this is the vagus. Here is the phrenic. Now, like this. You see this? Vagus, phrenic nerve. Yes.
Maxillary.
Maxillary. What? Nerve?
Yeah.
Maxillary nerve. From the here is visible branches. No, we have the specimens. This one, this here. Maybe no, it's not visible here. But I have the specimen where is the prepared. Yes, the trigeminal nerve, and is visible the maxillary. Here, from this cadavers, you see only the branch of the maxillary nerves. Here is which nerve is visible? Infraorbital. You see this one? It's very good. Yeah, visuals here. So you have the infraorbital nerve from your list. But this is a branch of the maxillary nerve, so the same, yes, level. And the next one is
Mandibular nerve.
mandibular nerve. From this cadavers is not visible the mandibular nerve. From this projection you see the mandibular nerve here where it goes from the bone, so it's like the alveolar branch. And here you see the branch of the mental branch. Yes, you see? Where we have the mental foramen. So this is the mental branch of mandibular nerve. Yes?
So the cranial nerves, olfactory nerve.